brief introduction of IPF research. IPF is a chronic, progressive, and fibrotic respiratory disease characterized by abnormal ECM deposition causing lung remodeling. The main clinical symptoms of IPF were dry cough and dyspnea, which mainly occurred in the middle-aged and the elderly. And the prognosis was poor. The median survival time was 2 to 5 years after diagnosis. A Chinese formula is an important part of traditional Chinese medicine intervention measures. Due to the diversity of active ingredients of single Chinese medicine and their potential synergistic effect, a Chinese formula has a wide range of targets and a variety of treatment mechanisms. Shilongjianji is an effective Chinese formula in the treatment of IPF. Previous animal experiments showed that Shilongjianji could inhibit oxidative stress and increase the content of antioxidant enzymes by improving the expression of TNF-alpha and its mRNA, regulating MIPs, TMPs, thus delaying the progression of IPF from multiple levels and targets. Network pharmacology can be used to study complex pharmacological mechanism. Combined with the system biology, multidirectional pharmacology, computer biology, and network analysis, the multi-level network construction of research content is carried out to explore the correlation between the drugs and disease from the multiple perspectives. Based on the network pharmacology analysis technology, this study will explore the potential mechanism of SLGG on IPF and select the corresponding pathway for animal experiment verification according to the prediction results, so as to provide experimental basis for the clinical research and drug development in the future. Here we will introduce prediction of the potential mechanism based on the network pharmacology. We will search TCMSP database and other databases to correlate all the effective ingredients of the SLGG and screen them according to the ADME parameters. In addition, we will search the relevant literature to supplement active ingredients. In this study, we will search TTD and other databases to download disease targets of IPF and standardize their names. Finally, 134 component targets, 2,024 IPF disease targets, and 108 intersection targets were collected. 126 single pathways were obtained by KEGG enrichment analysis. The pathogenesis of IPF is complex, involving a variety of cytokine and single pathways. Among them, TGF-beta is considered to be the most important pro-fibrosis cytokine. Abnormal TGF-beta signaling pathway is the most important mechanism leading to the development of IPF. Th1 and Th2 are subsets of the CD4 helper T cells. Alpha-GAR is the characteristic cytokine secreted by Th1 cells, and IL-4 is the representative cytokine secreted by Th2 cells. The studies have shown that Th1, Th2 imbalance exists in patients with IPF, which is one of the main mechanisms of IPF formation. Therefore, based on the predicted results of network pharmacology, this study will evaluate and explore the effects of SLGG on TGF-beta signaling pathway and Th1, Th2 imbalance in IPF model rates. Based on the predicted results of network pharmacology, we will verify them through animal experiments. 144 other male bachelor rates were randomly divided into 6 groups, which were normal group, model group, mathematics group, SLGGK group, middle group, and low group. 20 group 24 hours after model establishment. Drugs were given in 6 groups by garbage once a day. Rates from normal group and model group were given normal sealing of equal volume. The outcomes we detected include lung histopathologies. The content of F4 in serum were measured by ELISA. A Western blot and RT-PCR analysis will be used to detect protein and mRNA expression of IF-GAM, IL-4, TGR-beta1, TGR-beta-R2, SMART3, and SMART7 in lung tissue. A statistical analysis was performed by SPSS 15 version. As experimental results, the results of HE machine staining showed that the animal model was successfully established. 3 groups of SLGG can effectively elevate the lung inflammation, control the range of lessons, and reduce the collagen deposition. A pathological score of ovalitis. Compared with the normal group, the other groups were significantly increased. Compared with the normal group, the Western mass group, SLGG high, and middle dose groups were significantly lower, while the SLGG low dose group was significantly decreased on the 14th day. A pathological score of primary fibrosis. Compared with the normal group, the other groups were significantly increased, but there was no significant differences in the SLGG medium dose group on the 7th day and the 14th day. HYP content in lung tissue. Compared with the normal group, the number of rates in the other groups increased, but there was no statistical differences in the SLGG middle dose group. Compared with model group, in the same period, the HYP content in the Western mass group, SLGG high and middle dose groups were significantly reduced. Compared with the Western mass group, the SLGG middle dose group decreased significantly in 17 days. The results of ELISA as follows. The content of FN-GAM in serum. The SLGG high, medium, and low dose groups were lower than the normal group and higher than the model group. There was no significant differences between the SLGG middle dose group and the Western medicine group. The content of F4 in serum. SLGG high, medium, and low dose groups were higher than the normal group, lower than the model group. SLGG high and middle dose groups and the Western medicine groups had no significant differences. A protein and mRNA expression of FN-GAM on the 28th day. The protein and mRNA expression of SLGG high, medium, and low dose groups were lower than those in the normal group and higher than those in the model group. There was no significant differences in the protein expression between the high, medium, and low dose groups of SLGG compared with the Western medicine group. The mRNA expression of SLGG middle dose group was not significantly different from that of Western methyl group. The protein of mRNA expression of F4 on the 28th days, the protein expression of SLGG high, medium, and low dose groups were higher than that in normal group. But there was no significant differences in SLGG medium dose group, or were lower than the model group. There was no significant differences between the SLGG high, medium dose groups and the Western medicine group. On the 28th days, the SLGG high, medium, and low mRNA expression were higher than that of normal group, but there were no significant differences between the SLGG medium dose group and the model group. And there was no significant differences between the SLGG medium dose group and the Western medicine group. Protein and mRNA expression of TGF-beta1. On the 20th days, the protein and mRNA expression of SLGG high dose group, medium dose group, and low dose group were higher than that of normal group, and lower than that of model group. But there was no significant differences between the SLGG medium dose group and the Western medicine group. A protein and mRNA expression of TGF-beta2 on the 28th days, compared with the normal group, the protein expression of SLGG high, medium, and low dose groups were increased, but there was no significant differences in the medium dose group. The SLGG high and medium dose groups were lower than that model group. There was no significant differences between the SLGG high and medium dose group and the Western medicine group. On the 20th days, the mRNA expression of SLGG high dose group, medium dose group, and low dose group were higher than that of normal group, but lower than that of model group. There was no significant difference between SLGG medium dose group and the Western medicine group. Protein and mRNA expression of SMART3 on the 28th days, compared with normal group, the protein expression of SLGG high, medium, and low dose groups were increased, but there was no significant difference in SLGG medium dose group. SLGG high and medium dose groups were lower than that model group. There was no significant differences between the SLGG medium dose group and the Western medicine group. On the 28th days, the mRNA expression of SLGG high dose group, medium dose group, and low dose groups were higher than that of normal group, but lower than that of model group. There was no significant difference between the SLGG medium dose group and the Western medicine group. A protein and mRNA expression of SMART7 on the 28th days, the protein expression of SLGG high, medium, and low dose groups were lower than that of normal group. Compared with the model group, protein expression of SLGG medium dose groups was significantly higher. There was no significant difference between the SLGG high and the medium dose groups and the Western medicine group. On the 28th days, the mRNA expression of SLGG high dose group, medium dose group, and low dose group were lower than that of normal group and were higher than that of model group. There was no significant differences between the medium dose group and the Western medicine group. Okay, these are the best of protein and mRNA expression for all the targets. Conclusion. The conclusion of this study was that SLGG can improve the degree of abilities and fibrosis in IPF rates, and its protective effect may be achieved by coordinating Th1, Th2 balance and regulating TGF-beta1 smart signaling pathway In addition, the potential intervention mechanism in IPF treatment based on the network pharmacology prediction is worthy of further verification. Okay, the above is what I